I just thought that was the way it was. You know, this is my body, this is the way it has to be.
Since childhood, Audrey Castletine has struggled with the challenges of weight and overeating. By her mid-30s, she says, grocery shopping had become one of her favorite activities and biggest challenges.
Being in the candy aisle, everything would talk. Before I knew it, I'd have 6 or 7 sweet treats in my bag or my cart.
Try as she might to diet and exercise, Audrey says her obsessive sugar cravings always seem to win out.
I've also really stopped buying ice cream because I can't control myself around it, and still trying to find the happiness at the bottom of the pint. When I'm emotional and I'm sad, I can't grocery shop.
Audrey was diagnosed with depression. She wondered, was it the driving force behind her obesity or one more side effect? Her back ached constantly. She developed chronic acid reflux.
As a primary care provider, I think about all the comorbidities, the diabetes, the high blood pressure, the orthopedic problems that come along with it.
Mayo Clinic's John Ebert is Audrey's primary care physician. His diagnosis, a food addiction she's likely struggled with most of her life.
I remember, being 8 or 9 and being grounded for something and actually lowering a basket out my bedroom window so my friend Danielle could put candy in it.
As a teenager, bullying added to her body image stress. She remembers one tormentor in particular.
She would often call me cow, and the last time I wore shorts, she asked me if a cow had to try them on to make sure they fit.
Doctors elected to treat Audrey's mental health first with antidepressants and a medication to calm her eating compulsions. She went to private counseling and group sessions. Dr. Ebert prescribed lifestyle changes.
Starting with some basic things like keeping a diet diary, physical activity, food modification, caloric restrictions.
The more I tried, the more frustrated I became.
The problem is dieting is impossible. For this population of patients, that approach just doesn't work.
Good morning. Good morning.
Together, Audrey and her physicians agreed she was a good candidate for weight loss surgery, a gastric bypass.
Bariatric surgery is not an easy fix. It takes a lot of courage, it takes a lot of dedication, it takes a lot of motivation to be successful and to take that leap.
Mayo Clinic surgeon Todd Kellogg modified Audrey's digestive tract with a 3-hour minimally invasive operation called the Roux-en-Y procedure.
So the first step is to form the stomach, the new little stomach pouch, which is essentially the size of an egg, a small egg. And that we do that by cutting the stomach. Find the bowel and measure it and cut it. Bring one end up and attach it to that little egg-sized pouch.
Now, not only will Audrey have to eat less, only a fraction of her small intestine will be able to absorb calories. She works with a dietitian to carefully plan her meals. The tiny portions put patients at risk for protein, vitamin, and mineral deficiencies.
This is Brie.
Exactly 4 months later, Audrey has lost 64 pounds, down from her surgery day weight of 346. She's nearly 100 pounds lighter than when she first began considering gastric bypass 18 months ago.
If I can get below 200, that would be pretty fantastic.
Audrey's starting to jog again and looks forward to resuming her passion for horseback riding. She says she's also feeling lighter emotionally.
I've limited myself so much because of my weight. I hope it leads me just to live more